Hi, and welcome to EMT Quick Hits. I'm your host, Nathaniel. Today, we're going to be talking about test-taking strategies that you can use for your written EMT and EMS exams. Let's get started. So whether or not you're taking a block exam, a final exam, the National Registry exam, or just a quiz in class, here are some practical tips and tricks that you can use to score the best that you can on these written exams. EMS tests can be hard, but with these tips, we can make it a little bit easier for you guys to do. Let's start. The very first thing that you need to do when taking one of these tests is to relax. EMT and EMS quizzes and exams tend to be pretty high stakes, let's be honest. So taking that time to relax, focus yourself, can only benefit you. The test doesn't care if you're scared or if you're anxious. The test is not different if you're scared or anxious, but you are. You may misread something, you may not read something, you may even skip an entire question and not realize it, but make sure that you're taking that time to take a deep breath and relax. Once you're ready to go, you move into step 2, and that's to read the entire question. One of the biggest pitfalls that you can do is to not read the whole question and miss some crucial piece. Don't jump ahead to the answers. Read the entire question completely. Do something that I like to think of as reading out loud in your head. Read each word individually and say it out loud in your head. Don't bother the people around you. Don't necessarily sit there and mumble under your breath, though that may work for you. But read the entire question out loud in your head. This lets you carefully see each and every word that's in there. And then don't overthink the question. Don't add pieces in. If the question doesn't give you a piece of information about the scenario, don't add it in. Don't sit there and think about what if. What happens if I do that? Well, what happens if this happens? Or maybe this is going on. If the question doesn't give it to you, don't include it. Third, you need to figure out, what is this question asking? Ask yourself that. What does this question want to know? Is it wanting to know a fact? Is it simply a memory recall question like, what is hypoperfusion? Or is it more of a complex treatment synthesis scenario? Is it asking you what you should do next, or what assessment finding you would expect to see? Find out what the question is asking. Does it relate to more than one subject, or is it something else entirely? If it's true, false, or short answer, this still applies. The fourth thing that I want you to do is then analyze each part of the answer and look for key words or concepts. What I mean by that is look for if the question is giving you, especially if it's a scenario, is presenting you with a patient that's, say, in shock or going into shock. Consider the age, gender, or any other information that the question gives you about their medical history, their mechanism of injury, or the nature of their illness that might lead you down one path or another. Is this an elderly patient with beta blockers? You have to consider those things because they alter how vital signs may present. What vital signs is the question giving you? Is it painting a picture of a patient who is teetering on the edge and in compensatory shock? Or is it someone that is down the other side of that slope and is decompensating for their shock? Is it something else entirely? Is it prompting you with a threat to the ABCs? You want to look for those as well. Does the scenario tell you that they're not breathing appropriately? Is their airway intact, or is the potential there? Those are the things that you want to look for. Also, are you being caught up in any superfluous details? Sometimes you'll be confronted with a wall of text of a scenario, and then the question really is only asking you, what is the patient's blood pressure, for instance? So make sure that you're not getting caught up too much in any fluff that's there. Fifth, I want you to read all of the answers, not just the one that you think is correct. Start at the first one and move down. If it's true or false, well, of course you get to pick your answer. If it's short answer, you get to write the answer. But the vast majority of them tend to be multiple choice, so read all of those answers carefully, out loud in your head. Don't miss a single one, even if you think you know what the answer is. Most of the time, you'll be able to get rid of 2 answers right away. When that happens, throw them out. Then you'll often be left with 2 answers that appear to be correct. When you're confronted with that, there's two things I want you to do. First, I want you to read them carefully again and look for important words like always, never, except. Words like that can indicate whether or not an answer is correct. Very rarely in EMS do we do everything 100% or 100% in the opposite direction. Almost never, we never do something or we always do something. So be careful of those keywords that you find. Failing that, if they're both correct, look for which one is the most correct. Consider the order that we do assessments. What comes first? Our scene safety and our BSI. Then treating and assessing the ABCs. When we see life threats, we stop and treat them, and we don't get distracted by splinting or other things that aren't fixing the life threat if it's present. Then after you've read all of the answers, then you get to pick your answer. You may want to go back and reread the question again just to make sure you haven't missed something, but once you've read all of those and you have a good idea of what the answer is, pick it and move on. If you don't know what the answer is, mark it and come back to it if you can, if you have time later. You don't want to spend all of your time on one or two questions when you could have been answering correctly another 20 of them. Come back to it at the end. You may find the answer to the question in another test question later on. So always keep your eyes open for stuff like that. Also, other things that you can look for in your answers. If you're really not sure, if it's drug dosages, look for differences in units. Look for the difference between milligrams or micrograms, grams or kilograms. Make sure that dose calculations are not based off of the wrong unit. If you've got two numbers that are correct, then you have to go to the units and see if all of that makes sense. Hopefully you found the correct answer and can move on to the next one. If you haven't, well, we get to use a little bit of guesswork. If it's a 4-option multiple choice, you have a 25% chance of getting it right. But if you can use these steps to eliminate 2 of the answers, now you've moved that up to a 50-50 shot. Thanks for joining me. This has been EMT Quick Hits Test Taking Tips. I'll see you guys next time.